Hi, my name is Jim and I was retired. Now, in this week's video, I'm going to look at Medicare and specifically two stories on price controls in the Part D prescription drug plans. Now, the first is an announcement this week from the Biden-Harris administration to reduce the prices on 10 brand name drugs from Medicare, which is getting a lot of attention even though the lower prices don't start until 2026. But less well publicized is the sleight of hand price controls that will apply to your Part D premiums in 2025. Now, the question I have is, will Medicare Part D price controls work? Stay tuned. Now I'll go on screen to look at these two stories. The first, the announcement of these new lower prices coming in 2026 on the 10 brand name drugs through Medicare. And second, a new price support system that's being put in place for 2025 premiums. But first, will you please like and subscribe to this channel if you like entertaining ideas from a DIY retiree? It'll help my channel appear higher in the YouTube search algorithm. So let's take a look at these two stories driving price controls in the Part D prescription drug plans. And the first is the announcement this week that Medicare negotiated lower prices on 10 drugs. And these are high-priced brand name drugs that were costing Medicare and Medicare recipients lots of money to use. So as this article notes, the government negotiated the lower prices for the medicines for the first time, which offers an opportunity to rein in high healthcare costs. And the talks with the pharmaceutical companies, they announced new prices for the 10 prescription drugs. And the drugs cover serious conditions, including cancer, diabetes, and blood clots. And they cost the government more than $50 billion a year annually. Now, the lower prices should save Medicare, the government health insurance program, billions of dollars, but they will yet to translate into much savings for the many seniors. Among the medicines that are set to cost the U.S. less following these negotiations is Equilus, which will be priced at $231 for a prescription, down from the list price of $594 for a month's supply. Likewise, Merck's Januva will be priced at $113, down about 80% from its current price of $573 for a month's supply of a diabetes drug. Further down in the story, it notes that the Medicare will pay the prices starting in 2026, and the negotiations will save nearly $100 billion by 2031, according to the Congressional Budget Office estimates. Here's another little interesting note about these price controls. These negotiated prices on the brand name expensive drugs are being used to install a $2,000 annual cap on what members pay out of pocket. And that $2,000 out-of-pocket cap goes into effect in 2025, but the savings for Medicare won't start appearing until 2026. So they're taking future dollars to help pay for more benefits now with this cap. Now here's a little infographic that CMS put out on this new program, that 10 negotiated prices here. 8.8 million people with Part D coverage took these drugs in 2023, and that sounds like a lot of people. But it's like the 80-20 rule in reverse. It's about 17% of all those seniors covered under Part D plans in 2023. It's going to yield about $6 billion in savings and $1.5 billion in estimated out-of-pocket savings in 2026 for people with prescription drug plans. So here's the news release from Health and Human Services about the new negotiated prices. And I'll put links to this and all of the other articles that I've read about this program in the notes below. And here's a fact sheet that CMS put out about the drug price program, and it notes clearly that it's applicable in 2026. So this chart in the fact sheet lists the drug name, the pharmaceutical company, the condition, the agreed upon negotiated price in 2026, the list price, and again, list price in 2023. You may not have been paying this if your pharmaceutical company negotiated a better deal. The negotiated discount, which is from the 23 price, not the 24 price. The prescription drug cost in that calendar year of 2023, and the number of enrollees in 2023 that took that drug. And they range from 843,000 that took Januvia to 1.8 million that took Jardiance to nearly 4 million that took Equilus. So it does impact millions of seniors that are taking this, but there are a lot of seniors on Part D prescription drug plans that are taking generics, and that's all. You won't see any savings from this program for generics. Now, remember I said 8.8 million of the seniors in Medicare Part D coverage took those 10 drugs. Well, that was of 50.5 million total enrollees. So again, it's about 17% of the total population will be directly affected by this in 2026. This got all the headlines this week. White House says prescription drug deal will produce billions of savings for taxpayers and seniors. And it got a lot of press, like this AP article. Taxpayers are expected to save billions after Biden administration inked deals with pharmaceutical companies to knock down the list prices of 10 of Medicare's costliest drugs. But how much each American can expect to save when they fill a prescription at their local pharmacy remains unclear, since the list cost isn't the final price people pay. Another important fact. All right, the new drug prices are likely to most benefit people who use one of the negotiated drugs and are enrolled in a Medicare plan with coinsurance that leaves enrollees to pay the percentage of drugs costs after they've met a deductible, says Tricia Newman, Executive Director of Health Policy Research nonprofit Kaiser Family Foundation. And I've cited them before in my videos. It's hard to say exactly what any enrollee will save because it depends on their particular plan and their coinsurance, Newman said. But for the many people who are in the plans that charge coinsurance, the lower negotiated price should translate directly to lower out-of-pocket costs. Those savings won't kick in until 2026, and until then, some Medicare enrollees should see relief from the drug prices with a new rule starting next year that caps out-of-pockets to $2,000. Now, The Hill notes some political positioning of this price control announcement. The announcement was made 2 weeks before the legal deadline and days ahead of the start of the Democratic National Convention, an indication that the Biden administration, including Harris, the Democratic presidential nominee, is eager to campaign on the savings that don't show up until 2026. Lower down, The Hill notes that we don't really know the true savings Medicare is getting for each drug, and that's because the Biden administration promoted massive savings, and that Biden even posted a graphic on social media showing the discounts, which ranged from 38% to 79%, but all but one of the drugs had savings of at least 50%. But the figures released by the CMS are based on the list price. Rebates and discounts separate from those negotiations mean Medicare often pays less than the list price, and however that amount is secret, since Medicare doesn't disclose the net price it pays for the drugs. It's hard to ascertain the exact savings that were gained through these price control negotiations. Below these headlines on the 10 brand name drugs that are getting price controls in 2026 is this news release from CMS that announces a 2025 Medicare Part D bid information and a premium stabilization demonstration. So further down in this news release from CMS, they describe this premium stabilization demonstration, and CMS is conducting a voluntary demonstration to test whether additional premium stabilization and revised risk corridors for standalone prescription drug plans increase the efficiency and economy of services under the Medicare Part D program. That is bureaucratic language for is, can we give some extra aid to insurers to hold down premiums just before Election Day? So first, CMS is going to apply a uniform reduction of $15 to the base beneficiary premium, which is used to calculate the rate that you eventually pay. As part of that, they will agree to absorb some of any losses that the insurer has on their Part D premiums. So the game plan is to focus these premium stabilization programs on standalone drug plans, not those that are part of the Medicare Advantage plan. So those of us on Medigap that buy Part D coverage separately will get these special reductions if the insurer agrees to participate in this demonstration. So Kaiser Family Foundation took a look at that news release and digested it a bit too. And their key takeaways are that the Part D benefit will mean lower out-of-pocket costs for enrollees, but higher costs for the plans overall. And that's leading to possible premium increases. So to forestall those premium increases coming out and being announced just before the election, CMS is coming up with this demonstration to offer incentives for the insurers to keep premiums lower than they might otherwise be. So Political had another spin on this story. Biden administration to spend billions to blunt spike in Medicare drug premiums. And again, they went right at it and said that although this was Joe Biden's signature domestic achievement, it stood a chance to increase premiums just ahead of an election. So to get a jump on that, they've sought to reduce the impact with this demonstration. The new premiums will be released in mid to late September and could open up the Harris-Walz campaign to a spate of negative headlines. But efforts to alleviate the increase by giving health insurers an extra $15 per member a month have Republicans accusing the administration of attempting to buy a reprieve. It's using the federal treasury for political advantage, says Senator Bill Cassidy, a Republican from Louisiana. This is a way for the executive branch to implement a policy which has a very positive political ramification for them, but with very sketchy legal standing. The Federalist was even more blunt. The Medicare agency just gave Kamala Harris an in-kind contribution with your tax dollars. Now, this article noted that this is the Democrats' third use in recent years of legally dubious health insurance giveaways to protect them from political headaches. And I liked this article, too, from the American Action Forum from Douglas Holtz-Eakin and Parth Dahima. And they note that the whole Part D redesign is a tragedy in 3 acts. And it notes that basic premises of Part D insurance were to use the marketplace to drive down costs. But in each time, crafty Congress could not resist meddling, tossing in some taxpayer money here, cash from the farmer raid there, and generally trying to turn this entitlement unicorn into a run-of-the-mill tax and spend federal program. I encourage you to read this article as well. what are we supposed to do? As one educated consumer, here's my game plan for dealing with all these price controls in Medicare Part D plans. When my announcement comes out in September, I'm going to use that as the incentive to start shopping. As I've said before, Part D plans need to be shopped each year based on the drugs that you take and how you want to receive them. And it's going to be even more important that you shop for the total cost, premium plus drug cost out of pocket, that makes sense for you. Don't just go with who you're using now. In my case, Cigna is getting out of the Part D plan, so I'm going to be shopping for one anyway. Hey, I will conclude with my standard warning. I'm not a professional planner. I have no initials after my name, so take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one.